Good afternoon, class. We want to continue our lecture today. We are moving on to fracture, right? Fracture. Okay. So, under the musculoskeletal system, so we are looking at fracture today, right? So, if you take a bone, right, let's assume that this is a bone. Let's assume that this is a bone, right? So this is a complete bone, right, without any fracture. But in case there is an injury to this bone, and then it leads to a break in the bone. So let me draw the bone again. So let's assume that this is the bone, right? Right, so this break is what we term as fracture. Right, this break is what we term as fracture. So fracture is a discontinuity of a bone. A discontinuity of a bone or a break in the continuity of a bone. Right. So this is a bone that is intact, right? And this is a bone with fracture, right? Because you can see the break there, right? So that's what we term as fracture, right? So it's mostly caused by trauma, right? So any external force, right? Or sometimes excessive stress on a part of a body can also lead to fracture, right? And then sometimes muscle spasms can lead to fracture. Other times we have people with other conditions of the bone, right, like osteoporosis, etc., can also get fracture, right? So these are some of the causes of fracture. These are some of the causes of fracture. There are two main types of fracture, right? There are two main types of fracture. We have one is the compound fracture, right? And then the other is simple fracture, right? So compound fracture or simple fracture. With compound fracture is also known as open fracture, while simple fracture can be a closed fracture, right? So compound fracture is also known as open, while simple fracture is also known as closed fracture. Okay, so what does it mean when we say that a fracture is compound? It means that the bone is broken and then it affects the underlying skin, right? So it breaks and then opens into the underlying skin, and then that is what we term as compound fracture. But with simple fracture, is only the bone that is broken, the skin lying on it is intact, right? So it doesn't open into the skin, and that is a simple or a closed fracture. But there are several other types of fracture, and another thing is a fracture can be complete or incomplete, right? So a complete fracture is where the whole bone is broken, right? So this type of fracture, okay, so let me come here. This type of fracture, the bone is broken completely, right? And that is what we term as complete fracture, right? But with incomplete fracture, part of the bone is intact whilst the other part is broken, right? So with this type of fracture, we term it as incomplete fracture. But apart from that, there are several other types of fracture that we have, right? So let me mention few of them so that we can move on. One type of fracture, and these types of fracture can either be closed or open, right? Or it can be complete or incomplete. So one of them is known as green stick fracture. And then with green stick fracture is mostly a type of incomplete fracture, right? Because part of the bone is broken and then the other part is bent, right? It's more common in children. It's more common in children, right? So with this type of fracture, part of the bone is broken and then part is bent, right? Because with the bone of children, it's not it's not like adult bone where it normally breaks completely, right? Because it's not decalcified. So most of the time part is broken and then part is remain intact. So with green stick fracture is a type of incomplete fracture in which one part of the bone is broken and then the other part is bent, right? Then we have another type of fracture known as impacted fracture. Impacted fracture. Impacted fracture is where the bone is broken and then one part of the bone is driven into the other part. So one part moves inwards into the other broken part, and that is what we term as impacted fracture. Another type of fracture known as pathological fracture. Pathological fracture, right? So as the name implies, pathological, right? So if you have any condition of the bone resulting to a fracture, we term it as pathological fracture. So example can be cancer of the bone, osteosarcoma, etc., right? And then osteoporosis and other diseases of the bone that can lead to fracture, right? We have another type of fracture known as spiral fracture. Spiral fracture, right? So with the spiral fracture, what happens is that the bone breaks in circles, right? So they break and circles the bone, or it's mostly as a result of twisting of the bone. So there is not either straight, which is horizontal, or oblique, but it rather twists. So the break of the bone encircles the bone, right? And that is what we term as spiral fracture. Spiral fracture. Transverse fracture. Transverse fracture is the other type of fracture. Transverse fracture. So with a transverse fracture is a type of fracture that occurs straight across the diameter of the bone, right? So let's assume that this is the bone. This bone is intact, right? So when there is a break in this bone and then it's straight across, right? So this is straight across, right? So with this type of fracture, we term it as transverse fracture. And mostly, as you can see, transverse fracture is a complete fracture, right? And the break of the bone is straight across, right? So, and then the next type is oblique fracture. Oblique fracture, right? With oblique fracture, that it occurs at an angle across the bone or at 45-degree angle of the bone, right? So most of the time it's not straight. That one is a bit slant at an angle of 45 degrees. So this can be termed as oblique fracture, right? So it's not 90 degrees but half of 90. So at an angle of 45 degrees. Stress fracture is another type of fracture. Stress fracture. Okay, so if someone sustains a fracture as a result of using one particular part of the body for a period of time, so you put stress on a part of a body and then it results to fracture, we term it as stress fracture. People who are obese can have also get this kind of fracture, and people who engage in sports can also sustain this type of fracture. Comminuted fracture. Comminuted fracture. So let's assume that this is a bone, right? So this is intact, right? So the person sustains a fracture, and then there's a break in the bone, but it breaks into pieces, right? So as you can see, the bone is broken into pieces. So this type of fracture is termed as comminuted fracture, right? Comminuted fracture. And then there's another type of fracture known as depressed fracture, right? So if you have a skull fracture where the skull bone moves inwards and then compress on the bone, this type of fracture is termed as depressed fracture. And then even if you have facial fracture of the facial bones, it can move inwards and then compress on other organs, right? Avulsion fracture. So there are several types of fractures, right? Okay, so avulsion fracture, there are cases where some people will be brought in after RTA, and then you see that the bone is broken and then has removed the skin, so it has pulled the skin away. Sometimes you see the skin hanging, right? So if in this case, most of the time, if you want to suture, it means that the skin has to be brought back, right? So avulsion fracture, the bone breaks and then it pulls the muscles or the skin away, right? And then I will give you these two to go and read on: Colles fracture and Potts fracture. Go and read on these two: Potts fracture and then Colles fracture. Okay, so we are moving on. What are some of the signs and symptoms that someone with fracture will exhibit? Right, most of the time, the person who sustained fracture will present with inflammatory signs and symptoms, right? So most of the time, they will come with pain, they will come with swelling at the site, tenderness, right? So when you touch the part, they feel pain, right? Sometimes there's loss of function, so they cannot walk on that part, right? Or sometimes there's shortness, because if the bone breaks, right, and then it moves beside each other, it reduces the length, right? So until the bone is brought in alignment, it reduces the length of that part, right? So there can be shortness of the part, right? There can be erythema or ecchymosis. So depending on how severe it is. So if it's a compound, sometimes it causes bleeding under the skin, right? And then I've talked about edema or swelling. If it's not treated well, it can also lead to deformity of the part, right? And then sometimes there is also crepitus sound. So the ends of the broken bones, if they meet, it produces a sound which we term as crepitation. There can also be fever, right, due to the inflammatory process, right? And then if the patient is bleeding, it can lead to signs of shock, right? So you can have signs of shock. If it's a compound fracture, there can be bleeding, there can be signs and symptoms of shock, which include tachycardia, hypotension, etc. Okay. With fracture, you have to also assess for the neurovascular status, right? Or you are looking for signs of compartment syndrome, right? Signs of compartment syndrome, right? And then with the signs, we have what we term as the 5 P's, right? And then you add other 2 signs, right? So the 5 P's, you have pain, right? So you assess for pain at the extremity of the fracture, the fractured part, right? And then you assess for the pulse, you assess for the color, right? So most of the time there's pallor at the site of the fracture. You assess for movement, right? So you ask the patient to move the part, right? So you assess for paresthesia, right? And then pressure, right? And then there's what we call poikilothermia. So that is just assessing for the temperature of the parts, right? So you touch the parts with the back of your hands, right? And you feel for warmness or coldness. Most of the time, if there is poor, because with compartment syndrome is an indication that there is poor circulation to that part. So if there is poor circulation, the skin will be cold to touch. And you also have to assess the capillary refill of that part, and then all that. Okay, so causes of fracture, I've mentioned them already. So trauma, disease of the bone, stress, sometimes autoimmune disorders. Right? Risk factors include obesity, nutritional deficiencies, right, like low calcium, vitamin D, etc. can also increase your risk. And then smoking can also increase the risk of people in getting fracture. Bone healing, most of the time when there is fracture, just like we talked about in wound healing, right, the bone has to heal, right, and it's go through some processes before healing can take place, right. So the first process is known as hematoma formation. Hematoma formation, right. So whenever there is an injury, the inflammatory process will start, right? So most of the time, if it's a compound fracture, then it's assumed that the person will be bleeding, right? So there's hemostasis where the body there's vasoconstriction of the vessels, right? So there are some hormones that are released initially to cause the vessels to narrow, right? So that it will help to prevent excessive blood loss. And then there is release of platelets and then other clotting factors to also help initially to stop the bleeding. Once the bleeding is stopped, right, there is vasodilation that follows, right. So the vasodilation most of the time will help to send more blood to the site, right, the site of the injury, because before the bones can heal, there should be enough blood flow, oxygen, and nutrient to help the bone to heal, right. So vasodilation, there are other hormones, histamine, etc. that will be released to cause vasodilation to increase the blood flow to the site of the fracture, right. So when the blood gets there, it leads to hematoma at the site of the fracture, because without this the bone cannot join together, right. So the blood will form what we call hematoma at the site of the fracture. And then when the hematoma is formed, there will be new blood vessels that will develop within the hematoma formation, which we term as angiogenesis. So new blood vessels will form within. So let's look at it. There is bleeding into the broken ends because, right, so when there is compound fracture, there is bleeding between the broken ends, right, leading to the hematoma formation, right. And I said that there will be angiogenesis, new blood vessels forming, right. So the new blood vessels will help to send oxygen and nutrients to the site of the fracture, right, and then which will help in formation of fibroblasts, right, and then it will also help new collagens from forming, because these are what is going to strengthen the end of the bone for the bone to heal, right. So the next stage is known as callus formation. Callus, callus formation. So with the callus formation, the new collagen tissues that have been formed and the angiogenesis, they are soft, so it has to be hardened, right. So within 6 to 10 days, calcium is sent to the site to strengthen the part, and that is what we term as callus formation, right. So through this process, osteoblast, that is new bone cells, will be developed, and it develops within 14 to 21 days, right. So within 14 to 21 days, osteoblasts or new bone cells will be developed, right. And this will help to what we call ossification. There will be excess or new or more calcium deposition at the site of where the callus has formed, right? And this will make the bone, the broken end, hardened, right? And it's mostly this occurs within about 3 to 4 weeks after the fracture, right? So this thing that we are talking about is when the broken end has brought together, what you call reduction. So when the bone has been reduced, that is when the healing most of the time can take place, right? And then the last, so ossification is the next stage. So I've talked about hematoma formation, callus formation, ossification. The last phase is the remodeling. Remodeling, right? So remodeling is also known as reshaping, right? Okay, so when the fracture heals, sometimes there's excess cells formation which the body has to get rid of, right? So it gets rid of it by the process known as apoptosis, where the body tries to eat up the excess cells, right? And the process of shaping the bone, right, is what we term as remodeling, and that is the last phase of bone healing. There are some factors that can affect the healing of the bone, right? So the age of the patient. Sometimes if the person is a child, healing takes time. And then if the person is, the age is advanced, so about 50 years to the bone healing can take time. And then infection, right? That is why we are advised to, with open wounds, you have to manage it aseptically to prevent infection because it can delay the healing, right? And then the type of bone involved, right, where the bone is located can also determine whether healing will prolong or it will heal early, right? And then the severity, right? So if it's just incomplete fracture, it means that it will heal faster as compared to comminuted fracture, right? Right, okay, and then the blood supply, right? So it's also sometimes even other conditions. If the patient is diabetic, right, it means that the blood supply will not be as efficient as someone without the condition. So people with diabetes will might have the fracture being prolonged, right? The healing of the fracture being prolonged as compared to those without this condition, right? Okay. Diagnostic investigations, it include X-ray of the bone, right? So you can do X-ray of the bone, CT scan of the bone, MRI of the bone, ultrasonography of the bone. Sometimes a tissue of the bone, biopsy, can be taken. By, for example, if it's pathological, right, and then you want to know exactly what is causing it. And then you can also do arthroscopy, where you do endoscopic examination of the joints, right? So arthroscopy or arthrography, X-ray of the joints. Okay. With a nursing diagnosis for someone with fracture, you can't take pain out, right? So pain is one of them, related to inflammatory process, right? Or sometimes damage to the skin, right, can also cause severe pain. And even the bone itself have nerves, right? So there's a break, even if there is a break in only the bone without the skin, it can still cause pain. Okay, and then ineffective breathing pattern. Most of the time, if it's a compound fracture and the patient is bleeding, it can also cause respiratory difficulties or breathing difficulties. And then impaired skin integrity related to damage of the surrounding skin, right? So if the bone breaks and then it causes damage to the skin, right? And then, so there are several of them. You can formulate some on your own. Risks for infection related to the wound, if it causes a wound and all that. Okay. Sometimes it can even cause impaired physical mobility, right, because of the movement. Okay. With medical management, most of the time it's reduction, right? So most of the time reduction is done by the doctor, where the doctor tries to bring the broken ends of the bone together, right, to promote healing, right? So reduction, you can have open reduction or close reduction. With a close reduction, the bone is brought together without making an incision into the skin, right? Whilst with open reduction, the surgeon has to make an incision through the skin before the bone is brought in alignment, right? And then there can be fixation, internal fixation, and then external fixation. All these are medical management, or medical or surgical management. And then there can be traction, where a force is applied to hold the bone in position. There can be cast application, where you apply a cast, either a POP or a fiberglass cast, to maintain or to also help to promote the healing. Then prescribed medications like analgesics, antibiotics can also be given to help promote healing, prevent infection, and then reduce pain. So let's look at first aid management of fracture. So let's assume that you are going home on your way in a uniform, and then you come across an accident scene where one of them has sustained a fracture, a compound fracture, and the person is bleeding, right? So are you going to be like somebody who encountered a case like that? She was in a uniform, and then people were calling, where are the nurses? And he was also saying, nurses for no were here, where are the nurses, right? So if you meet a case like this, how are you going to manage the patient before the patient is brought to the hospital? Okay, so because you are outside the hospital, there are things you cannot do, right? And then there are things you can do. So outside the hospital, you can first make sure the patient is conscious. So you can assess the level of consciousness. And then before, you have to even assess the environment. When necessary, you have to move the patient away from any source of danger. Or if the source of danger can be moved away, you have to do that, right? And then once that is done, if there are tight clothing, you can loosen them. Assess the airway to make sure it's patent. The tank is not blocking the airway, or nothing is blocking the airway. And then you can assess the breathing and then the pulse to make sure the patient is conscious, right? So if pulse is absent and then respiration is absent, then it means that you have to initiate your CPR, right, to resuscitate the patient. And then you have to avoid unnecessary movement of the fractured part, right? So if you are with someone, you can let the person call the ambulance number whilst you are attending to the patient, and then you have to immobilize the fractured part, so you don't move the fractured part anyhow to cause injury and then to worsen the pain. And then I've talked about removing the patient from, so you're using tight clothing where necessary. You reassure the patient. If there are relatives or friends, other people around, you reassure them and make sure they don't crowd over the patient, right? Where the patient is bleeding, you have to stop the bleeding. Otherwise, patient will go into hypovolemic shock, right? So you stop the bleeding. You can use either the cloth of a patient or anything to stop the bleeding. But when stopping the bleeding, make sure that it's not too tight to obstruct the blood flow, right? And then you have to save the clothing of the patient while sending the patient to the hospital, so that we can have an estimate of the blood loss, right? I've talked about minimizing the number of people around the patient. Make sure if there is an open wound, you cover it to prevent death and other things from settling on it. Do not try to reduce fracture outside the hospital, right? So do not try to bring the broken ends of the bone together, right? Depending on how long you stay with the patient, you can apply ice packs if a part is swelling, right? And then I've talked about monitoring the level of consciousness. Outside the hospital, don't give anything by mouth, right? You don't give anything by mouth. So the patient has to be well assessed at the hospital before we will know whether to give something by mouth or not, right? We will continue our next lecture with management of fracture on the ward, right? So we do management of fracture on the ward, and then we will continue with cast management, traction, etc. before we end this the fracture, right? So read on it till we meet the next time. Thank you.